The solution to every global health crisis always hinges on one thing.
A person, a doctor or nurse, a midwife or pharmacist, a public health educator or volunteer trained in vaccinations. Every health crisis, whether affecting a small family or huge region, depends on whether the health worker on the ground has what he needs to do his job. She is the linchpin to the entire system. He is the hero of every story. Give her what she needs, and she will turn the tide of the epidemic. Save the child, educate the village, and teach her peers to do the same.
The shortage of healthcare workers is actually a crisis, and it's only going to get worse.
Yes, we have a lot of doctors, we have nurses, but they lack experience, they lack training.
We have 200 million children, those are under 14 years old, but we only have 90,000 pediatricians.
In the country, we do have problem with the shortages of trained health workers on TB diagnostic and treatment.
The population is growing. It's growing at an alarming rate, and the healthcare workers are not there to meet the need of a growing population.
In South Africa, due to the high disease burden that we've had to deal with because of HIV and AIDS, we have a very burdened healthcare system, and because of that, we have a shortage of healthcare workers.
We're estimating a shortage of about 13 million healthcare workers by 2035. Currently, it's about 7.4 million.
We have to be working on this now to train new health workers and to retain those who are already in service. Project HOPE considers the health worker the essence of our global health work. Health workers save lives, whether it's HIV or TB, maternal child health, non-communicable diseases, emergency response, all the areas in which HOPE responds. We always look at that through a healthcare worker's lens. In the maternal child health realm, we're really honing in on neonatal mortality, because newborn mortality has really not gone down at the same level as other child mortality and maternal mortality. In the Dominican Republic, we're working with them on advanced care, intensive care units. In Sierra Leone, which has some of the highest levels of newborn mortality in the world, we're working on the basics and primary health care, just making delivery safe and clean, providing essential newborn care.
Project HOPE has a lot of priorities, and we do a lot of great work. But none of this work would be possible without our donors, our partners, and our volunteers.
There are a number of organizations in the health field, but what makes HOPE so special is the sustainability of its missions. We don't go in and come out as soon as disaster hits in another part of the world. We go in and we make sure that the local community can sustain itself, that it has healthcare workers that are trained, that it has the life-saving medicines that it needs before we leave. Our reputation is one of really working with the local partners, our partners, to help make a difference. There's an awful lot more that we can and that we want to do. But we can't do any of that without the generous support that we're getting from corporations, from foundations, and from individuals with big hearts.
For me, what sets Project HOPE apart from the other organization, it touches people's life, saves the life. At the center of whatever Project HOPE is doing is to save lives.